Good afternoon, ladies and gentlemen. My name is Molly, reporting live from Plymouth, New Hampshire for Communities for Alcohol and Drug-Free Youth Advisory and Advocacy Council's first installment of CADY's World. Today we will be asking community members why they believe the nation is struggling from a serious heroin and opioid epidemic. Welcome to CADY's World. So, sir, what do you believe the #1 public health problem in the country is? No comment. What do you think our nation's #1 public health problem is?
I think that we're suffering from many public health problems at the moment, but the biggest would definitely be the heroin epidemic that is sweeping across New Hampshire and many of other states.
It's definitely drugs. Yep.
Yeah.
Sure.
Heroin?
I'm in college right now, so you see it in college as people start to experiment and do their own thing.
Would you be surprised if I told you adolescent abuse specifically was our #1 public health issue?
I would be surprised, yeah.
Unfortunately, not.
Yes, adolescents have been able to be getting their hands on substances more easily, so it can be prevented in adolescence, and that's mainly where it begins.
When do you think that the human brain is fully developed?
18?
That's close, it's mid-20s. A teenager's brain is wired to take risks. The human brain isn't fully developed until the mid-20s. Adults need to remember that the teen brain is a work in progress, and when drugs are introduced at a young age, it rewires the brain for addiction. Any substance use, including alcohol, marijuana, and prescription drugs that a young person misuses can drastically affect their lives and in some cases end their lives. Where do you believe that this heroin and opioid epidemic all began?
I think that's a really tough question.
I'd have to say ease of access to the drugs themselves. I mean, watching the programs that I've watched about it is that, kids that start on painkillers because they had an accident or something like that, that leads them to opiates, they buy on the open market because it's cheaper for them than getting prescription drugs.
Lack of attention to the youth, not as many programs, opportunities for them outside, within school, outside of school.
Okay. We think the best representation of our national drug crisis is the game Whack-A-Mole. This image shows us how we as a nation are reactive to problems in our country instead of proactive. The Whack-A-Mole shows how we are reacting to the heroin epidemic. The mole is up and all attention is directed at fixing that one problem. But this singular reaction is not a solution. The heroin epidemic stems from a larger substance abuse problem. What would you say if I said that it was low perception of risk? Do you believe that adolescence abuse starts with home, like in the home, issues with family, parents, stress?
Yes, I believe firmly that it begins at home.
Do you firsthand see this issue as you're out and about in the world today?
Being on a college campus, I think you definitely see lots of kids abusing lots of substances, but the majority of them know how to have fun without them.
It's not really public, but I can imagine it happening.
Prevention in New Hampshire and across the nation could benefit from increased youth prevention programs and by implementing curriculums to educate youth, adults, and families. We need to also provide alternative recreation activities and create programs for outlying communities because isolation is also a major risk factor. We also need to greatly expand outreach and prevention media campaigns. Prevention is going up against $1 million microphone. Alcohol and drug industries use smart psychological marketing to influence young people to begin using, known as the future client. Do you think that the issue that we have right now could have been prevented?
The thing that we have to do is, I guess, find out how could they prevent it and learn from it, and then create programs that address it going forward.
The solution to our problem is prevention. Prevention breaks the cycle of crime, protects children, saves lives, prevents addiction, and contains costs. Let's start the conversation. Talk early and talk often about the dangers of substance use. Kids need to know why not to use, not just because I said so. Thank you for being a part of CADY's World.